Answer these questions honestly. During your heaviest day, do you change your tampon or pad more than every 2 hours? Do you pass blood clots bigger than a quarter? Do you ever bleed through your clothes despite protection? Have you skipped work, school, or events because of your period? Do you feel exhausted for days after your period ends? If you answered yes to even one of these, you have what doctors call menorrhagia, heavy menstrual bleeding. And it's not something you just live with. It's a symptom of an underlying problem that needs treatment. Right now you might be severely anemic and not even know it. In 4 minutes I'm showing you exactly how heavy is too heavy, what's causing it, and what to demand from your doctor. Before we continue, drop a comment right now. How many of those questions did you answer yes to? And tell me where you're watching from. This affects millions of women worldwide, and most are being told it's normal when it's absolutely not. Quick disclaimer. This is educational information, not medical advice. If you're experiencing any of these symptoms, please see a healthcare provider. Heavy bleeding can have serious causes that need proper diagnosis and treatment. Let's establish what normal actually looks like, because most women have no idea. Medical guidelines define normal menstrual bleeding very specifically. A normal period lasts 3 to 7 days. You lose between 2 and 3 tablespoons of blood total across the entire period. That's it, 2 to 3 tablespoons. Most women have no frame of reference for what that looks like, so here's a better measure. Normal flow means changing your pad or tampon every 3 to 4 hours during your heaviest days. If you're sleeping through the night without leaking, that's normal. If you occasionally see small clots the size of a dime or smaller, that's normal. If you feel tired on the first day but bounce back quickly, that's normal. Now let's talk about what's not normal. What doctors call menorrhagia or abnormal uterine bleeding. Soaking through a tampon or pad in less than 2 hours. Needing to change protection during the night, or waking up to blood-soaked sheets. Passing blood clots larger than a quarter. Some women describe clots the size of golf balls or lemons. That is not normal. Bleeding for more than 7 days. Bleeding so heavy you can't leave the house or you're doubling up on protection, using a tampon and a pad at the same time. And here's the one most women don't connect. Feeling exhausted, weak, dizzy, or short of breath during or after your period. That's not just period tiredness. That's anemia. Your body doesn't have enough iron to make healthy red blood cells because you're losing too much blood every single month. If you're experiencing any of this, your body is telling you something is wrong. This is not just bad luck with periods. This is a medical condition with underlying causes that can and should be treated. Let's talk about what actually causes heavy bleeding, because understanding this helps you advocate for yourself. The most common causes are treatable. Uterine fibroids. These are non-cancerous growths in the uterine wall. They're incredibly common, especially in women over 30. Fibroids can make periods extremely heavy because they increase the surface area of the uterine lining that sheds each month. Polyps. These are small growths on the inner lining of the uterus. They can cause heavy bleeding and irregular periods. Adenomyosis. This is when the tissue that normally lines the uterus grows into the muscular wall. It causes heavy, painful periods. Hormonal imbalances. If your progesterone and estrogen aren't balanced, your uterine lining can build up too thick and then shed heavily. Bleeding disorders. Some women have clotting disorders like von Willebrand disease that make any bleeding heavier and harder to stop. Thyroid problems. An underactive thyroid can cause heavy, prolonged periods. And in rare cases, precancerous or cancerous conditions. This is why investigation is so important. The key point is this. Heavy bleeding is a symptom, not a diagnosis. Something is causing it, and that something can almost always be identified and treated. Here's what happens when heavy bleeding goes untreated. You develop iron deficiency anemia. Every month you bleed heavily, you lose iron. Your body tries to replace it, but if you're losing more than you're absorbing from food, you fall into deficit. At first, you feel tired. Then you start getting dizzy when you stand up. Your heart races going upstairs. You can't concentrate at work. Your hair starts falling out. You crave ice or strange things like dirt. That's called pica, and it's a sign of severe iron deficiency. You get pale. You feel cold all the time. You're short of breath. Eventually, your hemoglobin drops, so low you need iron infusions or even blood transfusions. I've seen women hospitalized because their hemoglobin dropped to dangerous levels, and they had no idea their heavy periods were the cause. This isn't just uncomfortable. Severe anemia makes your heart work harder to pump oxygen through your body. Over time, this can lead to heart problems. This is serious, and it's preventable. If you answered yes to any of those opening questions, here's what you need to do. Book an appointment specifically to discuss your periods. Don't let it be an afterthought during an annual exam. Make it the reason for the visit. Tell your doctor exactly what's happening using specific measurements. Not just, my periods are heavy. Say, I'm soaking through a super tampon every hour on my heaviest day, or I'm passing clots the size of golf balls. Specifics matter. Ask for these tests: a complete blood count to check for anemia. Measure your hemoglobin and ferritin. Ferritin is your iron storage, and it's often low even when hemoglobin looks okay. A pelvic ultrasound to look for fibroids, polyps, or adenomyosis. Thyroid function tests because thyroid problems cause heavy bleeding. If you have a family history of bleeding disorders, ask about clotting factor tests. Do not accept that's just how your periods are as an answer. That is not an acceptable response to menorrhagia. Push back. Ask what could be causing this level of bleeding and how do we find out. There are treatments: birth control pills or hormonal IUDs to thin the uterine lining, iron supplementation or infusions to correct anemia, procedures to remove fibroids or polyps, endometrial ablation to reduce or stop bleeding. In severe cases, hysterectomy. But you have options. Suffering every month is not your only choice. Here's the bottom line. If you're soaking through protection in less than 2 hours, passing large clots, or feeling exhausted after your period, that is not normal. That's menorrhagia and it needs to be evaluated. You could be severely anemic right now. Don't wait until you're in the emergency room. If this resonated with you, hit that like button and subscribe to the Sarah Mitchell channel for more women's health content that actually addresses real problems. Share this with any woman who's been told her heavy periods are just normal. They're not. And comment below. How many of those opening questions did you say yes to? Let's support each other in getting the care we deserve. I'll see you in the next video. Take care of yourself.